Hey everyone, and welcome back to our channel. Ever wondered why you swallow a pill for a headache but get an injection at the hospital? Did you know the same drug can act completely differently depending on how it enters your body? Today, we're diving into the fascinating world of drug administration routes. Let's make pharmacology simple and fun. First up, we have the enteral routes. This basically means anything that goes through your gastrointestinal tract. The most common one is the oral route. You just swallow a pill or liquid. It's super convenient and usually the safest option. The downside? The drug has to survive your stomach acid and then pass through the liver, which can break it down. This is called the first pass effect. A common example is paracetamol for pain relief. Next, in the enteral family is the sublingual route. Sub means under and lingual means tongue. So you place the tablet under your tongue and it dissolves right into your bloodstream. This is great because it bypasses the stomach and liver, so the drug acts much faster. The disadvantage is that you can only use it for small doses, and not all drugs can be absorbed this way. A classic example is nitroglycerin for chest pain. Last, for the enterals, we have the rectal route. This involves inserting a suppository. It's a fantastic option when a patient can't swallow, maybe because they're vomiting or unconscious. It also partially bypasses the liver. However, absorption can be a bit unpredictable, and let's be honest, it's not the most comfortable method. Diazepam suppositories are often used to stop seizures. Now, let's talk about the parenteral routes. This means the drug bypasses the GI tract entirely, usually with a needle. The big one is intravenous, or 4. The drug goes directly into a vein. The biggest advantage? It's the fastest route possible, with 100% of the drug reaching your system instantly. This is crucial in emergencies. The risk, however, is higher. Once it's in, you can't take it back, and there's a greater chance of infection if not done properly. Many emergency drugs, like life-saving antibiotics, are given via 4. Then there's intramuscular, or IM. Here the drug is injected deep into a muscle, like your upper arm or thigh. Muscles have a good blood supply, so the drug is absorbed steadily. It's great for drugs that need to be released a bit more slowly than 4. The main drawback is that it can be painful and you can only inject a limited volume. Most vaccines, like the flu shot, are given this way. Next is the subcutaneous, or SC route. This injection goes into the fatty tissue just under the skin. Absorption is slow and steady, making it perfect for drugs you need over a long period. The downside is that it can cause irritation at the injection site and is not suitable for large volumes. Insulin for diabetes is a very common example of a subcutaneous injection. A less common parenteral route is intradermal, where a tiny amount is injected just under the top layer of skin, mainly for things like allergy testing. Moving on, we have topical routes. This is when you apply the drug directly to the surface where you need it to work. For the skin, you might use a cream or an ointment. The advantage is that it delivers the drug right to the target, minimizing effects on the rest of the body. The disadvantage is that only a limited number of drugs can be absorbed through the skin. Hydrocortisone cream for a rash is a perfect example. This also includes eye drops for eye infections or ear drops for an earache. Finally, we have the inhalational route. You breathe the drug in, and it goes straight to your lungs. The lungs have a massive surface area and a rich blood supply, so absorption is super rapid, almost as fast as 4. It's fantastic for treating respiratory conditions. The challenge is making sure the patient can use the inhaler correctly to get the right dose. A common example is salbutamol, used in inhalers for asthma attacks. So, let's do a quick recap. We have enteral routes like oral, sublingual, and rectal that use the GI tract. Parenteral routes like 4, IM, and SC that bypass it. Topical routes for direct application to skin or eyes. And the inhalational routes for breathing the drug in. Remember, choosing the right route makes the drug safer and more effective. It all depends on the drug itself, the patient, and how quickly we need it to work. I hope this made things a little clearer. If you found this helpful, please hit that like button, subscribe to our channel, and let us know in the comments what pharmacology topic you'd like us to cover next. Thanks for watching and see you in the next video.